Welcome, everyone, to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
Yes, this is Kevin, and I have my guest here, Amy. And Amy, I know you told me your last name. Don't tell me. Let me look over here. I gotta look at my Facebook page and shit so I can fuck it up. Carmody, Amy Carmody. If you can, Amy, just introduce yourself. Where do you work? I mean, you don't have to mention names, but
Yeah.
like, what do you do? You know,
I
where do you work? What area? Where do you
Sure,
live and stuff like that? Talk about your nursing.
sure. My name's Amy Carmody. Have been a nurse since 1996.
Damn,
Worked
you
in
old like me.
Yes, I am. I am old, and I feel it every day. Been in healthcare since 1991.
Mm.
Started as a CNA. I live in Colorado. I've
Are you
done
from Colorado?
I am not.
Mm.
So
Where are you
you'll
from?
hear the y'alls and the fixin' tos. Born in Louisville, Kentucky,
All
and
right.
raised in West Texas.
I'm from Mesquite, Texas.
So yes,
Yeah,
we're
I know the
neighbors.
yeah, I know the y'alls.
Yep,
Right. That's good.
absolutely. Graduated from Angelo State University. Anyway,
So you
um,
graduated from San Angelo.
graduated in 96, and I've been a nurse since then. Did a little bit of everything. Pretty much everything except mom, baby, and OR and peds. Hurt my knee and had to have knee surgery. Couldn't go back to work. I was working in the ER, couldn't go back to that
Hustle and bustle. Yeah.
strenuous life quick enough and needed to work. And, this was 2002 when they still use want ads in the paper. That tells you anything about old. Saw an ad that said nurses work from home. It was also legit. So that tells you
Right.
also how old I am. And I thought, well, I can apply to that because I can certainly do that. And it was a hospice. They were looking for triage nurses. And I was,
But how does a hospice nurse work from home? Don't you got to go to the person's house to help see them to the
yes,
next phase of their journey in this universe? Like
they were looking for triage nurses. So somebody to
a
hire.
telephonic triage?
Yeah, they were looking for someone to send people out on the visits. This was
I got you.
the actually the original hospice in this area at that time, the largest one, and I was not hired for that position. As it so happens, I rode up in the elevator with the vice president of the agency, and it turns out that she was from Abilene.
Oh, shoot.
And we knew some of the same people.
That's
And I
good
had
though, right?
Oh, very good. I had no idea who she was, but she liked me, I guess, and they ended up creating a position for me that was kind of a hybrid. And so it was for a case manager slash on-call nurse, which was good because I think I would have not done very well if I'd have had to triage just straight off. And they did a really good job with orienting nurses.
But what are you doing as a triage? I mean, when you say triage, I'm thinking ED triage. So what do you do to
Sure.
triage? Like to see if they meet hospice criteria?
No, you're getting the calls when people are calling it, after the office is closed. And so you're taking those calls and seeing who needs what. Is it somebody who needs a medication called into the pharmacy? Do they need a social work visit?
So you're saying these patients are already hospice patients.
Correct.
They're calling you saying, hey, my mama's not feeling good. She ran out of morphine at 3 o'clock in the morning. Can you give me some morphine?
Something like that. Or she
And
had a
you're,
call. Can you come out and, pick her up? Or
no, no, I'm not going to come out and pick her up. You can't pick her up. That's your mama.
that's what we're going out there for sometimes.
See, I couldn't
3
be a
in the
hospice
morning.
nurse. I get in trouble. Like, no, I'm not coming out. You pick her up. And why did you wait till 3 o'clock in the morning to run out of morphine?
You know what? I can't tell
See?
you how many
I
times
know.
we have said that to each other,
I would
but
say to the patient and the family, that's why I couldn't be a hospice nurse. I get in trouble.
yeah, we
You
have
know,
said
the
that to
pharmacies
each
are
other.
open during the fucking day, right? They're not open at 3 in the morning. Like, what the
We have said that to each other, but we do not say that to
I
the
know, I
patients.
know, I know. But that's why I don't work hospice because I would say it.
Yeah, you do not say that.
I get you.
But when you get those calls at 3 in the morning, and usually it's not the patient's families, usually it's the assisted livings who are doing their med reconciliations at 2 in the morning, and they're awake, so they're calling the hospice.
Really? Like,
Yep,
that can't wait?
yep,
Are you on call 24/7?
yep.
Oh, shit, is that salary position?
Well, so
I definitely can't be
usually it
you're
just
bugging me in my nighttime and I can't sleep over medicine?
it just depends. It depends on the hospice. There were some hospices I worked at where it was 7 on, 7 off,
Oh, I got
and
you.
so you were working from 5 PM to 8 AM Monday through Friday, and then and then Friday, 5 PM till Monday morning, 8 AM, so you were on that whole
I
weekend.
got you.
Those weekends really sucked.
Right. That's a lot of work and stuff.
Yeah, and then there were some
Is it a
uh,
salary position or hourly?
so my first job that I was with for 7.5 years was hourly, and we worked
I got
8-hour shifts, and that was really nice.
I got you. All right.
Every position after that was salaried.
That kind of sucks though, because your people bug you and you're 24/7. But I guess it's nice if you work from home, but you don't always work from home. So,
Yeah, I mean, it's not always triage because sometimes you're going out, you're the person, so
right.
it just depends.
Who's paying for my gas?
We got paid mileage, we
All
get
right.
paid.
That's good. All right.
Yeah, so you're getting paid mileage, not always what the government,
I know.
you
Government
know,
cheap. I know.
but you get paid mileage, and it's pretty I mean, it was a pretty nice job.
Better than picking up heavy patients and breaking your kneecaps and stuff.
Oh, you're doing that
Yeah.
too. You're
Oh,
doing that too.
yeah. Never mind. I'm not doing it.
You're getting called out and trust me, you're out there and you're the only one out there, so you have I
What, you
mean,
don't, the family can't help you?
they can't if
They
when
can. They
you're
just choose not to.
well, no, sometimes they're elderly too,
Oh, I got you. I got you. I'm with you. Okay. Like a
you know
husband and wife, old husband and wife. He can't really do much, or she can't
right.
really do much. Yeah, that kind of fucked up.
Yeah,
But
so
so,
you're out there and it's or the kids are elderly, or they're injured, disabled themselves, or the patient weighs a lot.
so I didn't know that you could be on hospice and be in assisted living. I
Yeah,
thought this is just my from what I know. That's why I had you on because I don't know that much about hospice. I'm going to be honest. You're there to help send them to the next phase of their journey by giving them a couple morphine and like bye. I know, but that's what
mhm,
I think most people think when it comes to
right,
hospice. If you're not familiar with hospice,
sure.
that's why I wanted to
So
talk about
we
this.
can take care of patients wherever they are.
But can a hospice patient be a DNR? I mean, sorry, can a hospice patient have a DNR? I thought they were ready to go see Jesus.
A hospice patient is not required to be a DNR. We
But
have had
what
many
if
that
they,
are full codes.
yeah, but that doesn't make sense. Then why be hospice? Because I thought hospice meant you are
I
helping people to the
know.
next journey.
Believe me, I've wondered that many times myself, but
That's not in the
here
rules and regulations.
it is not. They are
That's
not
bullshit.
required to be a DNR. So there's 2 things that a hospice patient has to be
Is
for
this
them
nationwide or is it Colorado specific?
this is nationwide.
All
This
right.
is Medicare regulation.
All right.
Now, obviously, for private insurance,
They can
it's
change
different.
whatever they can add to and all that. I got you. Okay.
Exactly, but
So
the
what
Medicare
about
reg says they have to have Medicare Part A, obviously, right?
right?
That's part 1. Part 2 is they have to have a terminal prognosis as determined by 2 physicians if the disease runs its course within 6 months or less. So,
So
uh,
in other words, my terminal disease can only be 6 months or less. If it's longer than 6 months, I can't get on hospice.
if it runs its natural course, and that's how these people can stay on for longer than 6 months because even
Determined,
Medicare
not.
understands that doctors are not God
I got you. Okay.
because they can't prognosticate. That's if it runs its natural course.
If you're a hospice patient and you have a terminal illness, which means you're about to go see Jesus or whoever you believe in, and it's signed off by two MDs, I can be a hospice patient, Medicare Part A will pay for it, and I can still say, I want you to do everything for me to keep me alive.
And I should say, let me back this up. It doesn't have to be MDs. It can be, well, it has to be an MD or a DO to
I got you.
certify, but an NP or a PA can refer to hospice.
Right, I got you. I got you. All right. So I got a boatload of questions here.
Sure, sure,
I'm gonna
sure.
try to get through them all and stuff. But what inspired you to pursue a career in nursing, particularly in the field of hospice? Did you? I know why you got into nursing already. We talked about that, but is it only because you got hurt that you wanted to get in hospice? Why didn't you do something else? Why
So
hospice? You like to see people die?
I went into nursing because my grandmother was a nurse.
Right.
I got into hospice honestly because I saw that ad. And when I got there, it just clicked for me. We can see patients one at a time. We get to spend time with them,
Actual
um,
nursing care.
actual nursing
All
care.
right.
We get to, I've gotten to take lunch to patients. I've
Mm.
gotten to spend time with them.
To get Meals on Wheels.
That's right. Play games with them. I've actually stopped a patient, helped a patient's family stop the patient from being scammed.
Oh, right on. I got you. Yeah.
Tens of thousands of dollars.
Right. Because they're gonna
Um,
prey on the weak and stuff. That's right.
I've
Raising this. Oh, that's sick, isn't it?
It is sick. I mean, I walked in and I'd seen her for a while. I'd been seeing her and I realized she had mail piling up on her table, and she was one that was always really organized. She
Right.
told me that the person that paid her bills wasn't coming,
Oh,
and I reached out to her family, and come to find out
there was nobody paying her bills?
the person wasn't coming and they were still charging her, and not only that, they were taking money out of accounts and over
That's
$30,000.
that's ridiculous, man. All
Mhm.
all on the dime of an old lady dying and shit.
Yeah.
I know that was a memorable experience, but can you share another memorable experience from working in a hospital that has a profound impact on you?
Yeah. This I actually do have permission to share. We were given written permission, so this was
No
years
worries.
ago. We had a program at a hospice that I worked at. We had this program, and this patient had been a dancer, and he was just slowing down, right? And sorry,
You're
it's
fine.
just one of those things,
Yeah, you're okay.
all he wanted was to have his favorite meal from his country club and to dance. And so we reached out to his dance partners and they brought him his favorite meal from his country club, and they came over and they danced with him in his living room.
It's nice.
And he took his oxygen off there in his living room. And let me tell you, I cannot hear the song "A Mambo Mambo" without a big smile on my face.
'Cause you're thinking about him. Yeah,
Exactly.
that's good.
And, you know, I couldn't do that anywhere else.
Yeah, that's good though. But see, you're making a difference though. That's what people don't realize.
It
Yeah.
makes such a difference. The
Yeah.
oxygen didn't matter, nothing else mattered.
Right. I get that. I'm sure you have seen some things that were worse though. I won't ask about those, but I can
Oh,
imagine
I've
what the things
seen
you see, right? So what unique challenges do you face as a registered nurse in the hospice setting and how do you navigate them?
well, you know, obviously, we don't have help in the homes. If we know ahead of time, we can take somebody with us. But, we're walking into people's homes
Right.
where we don't know what we're walking into. So, we're walking into
So
very
do you ever
hazardous conditions
right, have
sometimes.
you ever gotten somebody where their loved one was dying, they don't want them to go and then they're blaming you for it? And have you ever felt unsafe?
Yes, I've had a
Is that
gun pointed at me before.
Would you say that's part of the job?
No,
Did you press charges?
absolutely not. At the time, no.
See, why they look at me. How come fucking nurses don't press charges? That's not appropriate.
I agree. I was young
I know, but
and
see, right. But
I
we're made
was
to feel like it's part of our job and
my
that
boss said to me the typical thing, "What could you have done differently?"
motherfucker. Was it a guy or a girl?
It was a girl,
See, so I don't want to
and
hear any of you motherfuckers talking shit about dudes. Cause we would
nope,
have went over there and kicked ass and shit. What can me? What could I have
and what
done?
I said was, "I guess I could have not gone to the visit
That's
because that's
crazy.
the only thing I could have not done."
Yeah, that's stupid. Like
I actually ended up leaving that job.
you should have made her fucking go.
I tried, actually tried.
Yeah, she's too busy in her office and stuff.
Yep. Oh, it was bad.
So how
That
do you?
part probably shouldn't be in.
No, you're fine. It's okay. No,
But
nobody knows who he or she is, so it's okay. We didn't
yeah.
mention any company names. Don't worry. You should go listen to all my episodes. I talk shit about everybody. I do because I'm trying to make a change in nursing because we put up with too much crap.
We do.
People
It
think it's
was
part of our job, and it's not. It's ridiculous. We don't
that
need to be unsafe.
I agree.
Yeah.
I agree. That was terrifying. I've never there have been times I have been terrified, and there have been other times and yeah.
Yeah, I got you. Well, I just was in the ED, I don't know, like a week ago, and the patient was obtunders, and but I'm going through his stuff, and he's got a damn screwdriver because he probably used it to protect himself because he was a homeless dude.
Mhm.
If he wasn't, if he would have became violent and I didn't go through the stuff, I would have never known it. He could have stabbed me and shit. So
Yeah.
I tell nurses always go through their patient's belongings so you so you know what's in there, and if it's something like that, give it to the security and stuff.
Yeah.
It's crazy. All right,
Yeah.
so how do you
So I'm
go ahead?
sorry. I was just gonna say, that's one thing we'd have to deal with whether we deal with I have to tell you this one time back before computer
Right, right. Paper
really a
charting.
thing. Yeah, we had a patient that died. It was
Mm.
1 o'clock in the morning. I went to the death, and the information I had was not correct. And I went and knocked on the door at 1 AM. Lights were on. It was a party.
Oh shoot. A party for
And
the dead person?
no, they said, "Oh, they moved." I said, "Oh," they they said, "Didn't think the party was that dead." I'm like,
So did your patient really move
"Patient moved."
and
I
didn't
had
tell you?
well, I had my stuff wasn't updated. I
Oh
don't
my
know if
lord.
we knew, but my stuff wasn't
All right.
updated.
That's crazy, right? I'm here to see the
Yeah,
dead person.
I'm like, "Oh."
Can you
I
imagine
mean,
that? You going to the
yeah,
wrong house and that's good though. I
we
like
have
that.
but GPS that leads us to the wrong
Crazy place.
place
Right, right.
and being given directions like turn at the blue mailbox on the
Mhm.
dirt road
Yeah,
and
I get that. I don't know what's gonna happen when people don't have maps and shit and
yeah,
all the power goes off. They don't know where to go.
wildfires,
Right.
I know you being in California, right? You
Yes.
have to deal with those too. We had one that came into Colorado Springs a few years, well,
Right.
about 10 years ago and then up the mountain a little bit and having to deal with
Right.
disasters, and
Crazy.
when you're dealing with patients that are not in one place, it's a little bit different than being in the
Right.
hospital,
'Cause you
so
gotta drive everywhere to the different locations to find them, and
and you gotta have a plan for what you're gonna do with those patients.
so who makes up the plan? You or the company?
We do. The executive director has to make it up for each office,
I got you. All right, that's good. I
so
mean, at least you're thinking about the patients ahead of time in case things happen.
you have to have an emergency plan
Yeah,
for each
that makes
office.
sense. Yeah.
Yeah.
How do you approach providing emotional support to patients and their families during end of life care?
So, it's really about listening. You have to listen to what their actual need and questions are. You know, you can't help them if you don't know what the concern is.
All right.
So, if they're worried about pain, you listen and find out, okay, and tell them, okay, well, you're worried about pain. I can tell you how I'm going to help you with pain. If they're worried because, you know, they're worried about going to hell, me answering that I'm going to take care of their pain isn't going to help them
Right.
for nothing. So I'm
But
going to
how are
reach
you? How do you, as a nurse, minister to somebody who's worried about going to hell? What if
I'm
you
going to
don't believe
reach
it?
out to my chaplain
Okay.
and have them come in and help them with that because, you know, hospice has we are required to have a holistic approach.
Right.
So it's part of our conditions of practice,
Right.
participation.
What if they don't believe in heaven and hell?
Well, then I'm gonna find out, is it family dynamics? Is it, what else is going on? If
Right.
it's not that, then maybe it's family dynamics. I'm gonna reach out to my social worker and get them involved.
Do you really get a lot of support, or is it like pulling teeth to get support?
We have the social worker and the chaplain as part of the team.
So
So
they're part of the hospice company and team already. You don't have to go and look for them, and they're there.
right,
All right.
right. So that's a requirement. We have the physician, the nurse, the social worker, and the chaplain is all
All
part of
right.
the team.
That's
And
good.
so as soon as they come on service, the nurse, of course, is the first person to see them. And then the chaplain and the social worker have 5 days to do a comprehensive eval, unless the patient declines the chaplain and the social worker.
Right.
But we try really hard to get them in to see them because of situations like this. We want them to build that rapport as soon as possible so that
Right.
they have that.
That answered my next question. I was going to ask you already. So that's good. So, how do you handle instances where patients express fear or uncertainty about their end of life journey like that? Like you just said that you call social workers, you use other kinds of support.
Yeah.
So what about a situation that you had to make a difficult decision in regarding a patient's care in a hospice setting, and how did you approach it? What's been one of the hardest decisions you had to make?
We don't typically make decisions for patients. That's not our job. We are there to guide them, to give them the information to make the decisions,
Do you ever
but
give your advice?
we shouldn't.
I know, I'm just
Um
asking. I mean, we're human. I know, but we're human. People ask
Sure.
stuff. So,
I try really hard to keep my views and my opinions out of it. I mean, obviously we are human, but
can I
I
ask you a personal question?
of course,
Are you a super religious person?
am I super religious?
Are you religious at all? Spiritual?
I'm religious, I guess. I
Only reason why I'm asking because a lot of people
yeah.
that are super religious don't believe in giving morphine or kind of helping people move to the other side because they see us as murdering them.
You know,
I know it's a
there's
hard one, isn't it?
no, not really. When I worked in the ER, and I don't know if the teaching on this has changed from 20 plus years ago, but what I learned back then is that morphine actually helps the oxygen get to the heart. So if somebody is struggling to breathe, it actually helps.
Right.
So
So you
I
are you saying that nurses who think you're pushing the patient to go see Jesus sooner or killing them don't understand their medications? Is that what I heard you say?
that's That's what I'm saying. I mean, to a degree, not
I know that. I
completely.
got.
Obviously,
I'm
if
not
you're
trying to put words in your mouth.
oh, no. But if you're giving 2 milligrams of morphine, I mean, to somebody who's been taking morphine or, I'm not gonna come in and give somebody 20 milligrams of morphine who's been opiate naive, but when you're
Right.
talking about somebody who's sitting there struggling, 2 milligrams of morphine is not gonna kill them.
My personal experience. My mom had a massive stroke,
Mm,
and she wasn't her anymore. And so my brother and her husband, my mother's husband, wanted to move to another hospital, but she wound up having another massive stroke and made her
okay.
situation even worse. So I told her, I said, just put her on comfort care, give her some morphine and help her move along to the next side. And so when the nurse came in, Texas nurse, by the way, she gave 20 milligrams of morphine. I'm like, oh, I like you. Because most nurses won't do that. 'Cause,
Right.
you give that much, you know what's about to happen.
Yeah, and, it depends too, and I would say I'm probably at this point more spiritual than I am religious,
Right.
and I am, you know, I was raised very religious, and I do believe in God and heaven and hell, and but I am very much about taking care of the patient and seeing them
Right.
comfortable and making sure that their needs are met. And I don't want to see somebody struggle. And, you give them, you start with a little bit. And this is how I was taught when I started in hospice. You start with a little bit. If that doesn't work, you give them a little bit more. If
Right.
that doesn't work, you give them a little bit more.
Right.
And you give them a little bit until you find out you give them the least effective amount.
Right.
And you give it until you know what that effective amount is, and then you know how much you need to give them.
Right. Yeah, I'm okay with that. I get that. When you have a hospice patient, though, if you did, I'm not saying you would, but if you did give so much that it made them stop breathing, are you going to resuscitate them?
No.
Does that make sense what I'm asking?
I see what you're asking, but if somebody's a DNR, you don't resuscitate.
Right.
If somebody is a full code and they're struggling that much, you're not gonna be sitting there giving morphine, giving morphine. If they're struggling, 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 they're gonna be in the hospital.
So do hospice patients go to the hospital?
Yeah,
Because I'm just going to be honest. I think if a hospice patient came to the ER, most ER nurses would be saying, "What?
I know.
Why the fuck are you here for? Why aren't you in home dying and shit?" But
Yeah, I
I'm
mean,
just being for real.
absolutely.
People don't like that. They may not like what I'm saying, but it's true. I know that most people think that.
I know, I
I'm
know.
an
Well,
ER nurse. I
but
know.
so here's the thing. People can so what Medicare says is patients can get treatment for things that are not related to their hospice
Right.
diagnosis. So if a hospice patient is on services for, say, cancer, which is probably not the greatest example,
Example. I
but
know. But I got you.
say they fall and break their hip and they want to have hip surgery, they can go and get hip surgery and, all things being equal, and it's not related in any way, shape, or
Right.
form, they can go and have that hip surgery and it's going to be
But
covered.
a lot of people see that as wasting resources and supplies because the person has a what?
Less than 6 months.
All right. See what I mean? So I
I
get both
know.
sides, but it's a hard decision, isn't it?
But when you think about it, is that broken hip going to cause them a lot of pain for that last 6 months?
Yeah.
So that's not going to, you know what I'm
You're
saying?
not giving them a quality of life for the last 6 months they got.
Right.
I got that. I have a different viewpoint. Like, I don't give a shit. You can do whatever
Right.
you want to do. If we as a society are willing to pay for it and you want me to code your 104-year-old grandma that's got stage 4 cancer, I'm going to do it because that's your decision as a family member. I don't
I
take it
mean,
personal. I don't get upset because I'm there 12 hours. So,
I understand the thought process from both sides having worked in the ER, so I get
right.
it.
But it's hard though.
I
I get
just
you.
I
Yeah.
just I see it from both sides, I just get it.
That's why I think that nurses should work different areas so they can see all around and kind of have a different viewpoint and maybe would change our thought process on how we deal with patients and stuff if we are a little bit more well rounded. I
Yeah.
do. I get that. So can you see what strategies do you employ to maintain your own emotional well being while caring for patients who are nearing the end of life? So you see a
Well,
lot of death and dying. So how do you keep from going crazy?
so I
Everybody's gonna
am
take an emotional toll on you one day if you don't
well,
take care of
I
yourself.
I actually am working remote right now. I am doing audits for my company now. I had some health problems
Mhm.
and I just couldn't do hands-on care.
Right.
I actually stepped out of the field and was doing managerial before I came remote.
You went to the dark side.
I did
Oh,
because I wanted to make a difference,
I
and
got
I think I did. I got tired of saying something needs to change, and I decided I wanted to help be the change.
yeah, that's good. That's why I
Um,
started doing this. I wanna be the change. Yeah,
so I started wanting to make a difference, and I did make a difference for some people. Not everybody liked me. Never gonna happen, right? You're
yeah,
never gonna make a difference for everybody, or you're never gonna have everybody like you,
Right.
but I did make a difference for some people. That said, I still, even as a manager, was still going out and seeing patients from time to time because I didn't ever want to be the person that I figured if I didn't wanna do anything, I wouldn't expect my team to do.
Right. I got that. No, I got that.
So,
So how do you prioritize and manage your workload now that you don't have to really go out anymore, do you?
no, not anymore,
Your
I
all
can't.
audits and stuff?
But what I did back then was I discovered what I could do. I discovered how much I could do, and that's what I said I could do.
Oh, that's good though. You set
And
boundaries.
I did. I had to set those boundaries, and that's all I expected my team to do too when I was in management.
And we're going to talk more about boundaries tomorrow with Matt Norman. His book is called The Restored Nurse, and he talks about setting boundaries. So that's good.
Awesome.
So, as a seasoned hospice nurse, what key insights or perspectives would you like to share with nurses and other disciplines better to prepare them for dealing with challenging outcomes, such as unexpected declines or complications for hospice nurses? I know it's a big question.
It's really important to utilize the hospice team, remember to they're here to help you, so make sure you're calling them. If your patient's already on hospice, reach out to that hospice team.
So, if I'm an ER nurse, can I reach out to a hospice team? Would they come and help?
If the patient's on hospice, I mean, obviously, if the patient's in the ER, they're not gonna be coming and taking care of the patient, but call them. Make sure communication is key. They should be communicating with you when that patient is there if they know. Unfortunately, we don't always know when a patient is
Okay,
heading to the ER, but
right.
if that patient gets there, call them. Let them know they're there. They can communicate with you what's going on. You know, it's key. Let them know we can I was always communicating with the ER when our patients went there, with the facility staff, the nursing homes, the assisted livings, anything like that. We can help with our social workers can help with facilitating sometimes, especially if a patient has been a home patient when they're in the ER, and maybe that's not exactly ideal for with them going back. They can maybe help with placement,
I got you.
things like
Okay.
that.
Yeah. What are some common misconceptions that nurses from other disciplines, like this is how you and I got here. What are some common misconceptions from nurses from other disciplines that we may have about hospice care? How can they be addressed to promote better understanding in our collaboration?
Well, big one is that all hospice patients have to be DNRs. Another one is that we kill patients. Another one is that they come on and they can't be on for any length of time. Another one is that
DNT,
DNR means DNT,
right?
that we can't take care of IVs, or that we can't do anything, or that we don't have any skills. I've had patients, it's been rare, but I have had even a patient in the past, or well, probably more than one, but I know of one in particular that was on TPN.
Right.
Again, that's rare.
I was going to
Um,
ask you, don't you get a lot of end of life care patients or hospice patients that have Mediports, things like that?
We do. Had patients with Mediports, patients with PICCs, patients with central lines, patients we've had to start IVs on, patients we've done sub-Q for, some gentle fluids or even some pain meds. I mean, that's been years, but I wanna say it's been a long time, but I think I've even done palliative sedation, but
Oh,
that's
yeah.
been a long time.
So what
We've
do you say in a nice way? I don't care if you're nice or not, but what do you say to people when they say all hospice nurses kill people or they're terrible and they don't do a good job? That's the only reason why I reached out to you because I don't like when people say all this or all that because it's not true. That's like saying all ER nurses suck ass. That's not true. Every discipline has shitty nurses.
Every profession has
Right.
shitty something. Every profession has really great something.
Right.
There's just what I say is, you know, I'm sorry that you've had that experience. I really hope that you come across somebody that does a good job
Right.
someday
Right.
because that's not the experience that we've had. We've even done external outside the hospital terminal extubations on people so that patients could be at home
So
where
you
they
take them
wanted.
from the hospital to the house, and then you extubate them so they could die at home. If
Exactly.
their family members and things like that.
Yeah.
Oh, that's nice. All right,
I
that's cool.
mean, we've done so many things and we work so hard so that patients can be where they want to be with their loved ones
Trying to
and
give them a dignified death.
exactly, and give them the support and the comfort and
Well, let me ask you this, because I don't know the story, but I can see it already in my mind. What we were talking
yep,
about, you and I off. Maybe it's a cancer patient or some kind of hospice patient that had a lot of wounds,
mhm.
cubitus, because they were somewhere else or somebody wasn't taking care of them. You get involved as a hospice nurse, but are you a wound nurse?
I'm personally not.
Right.
Um,
So how are you a hospice nurse able to take care of wounds if that's not your specialty?
it depends on what the wound is, right?
Right.
If it's a basic wound, we can take care of that. If it's a really horrific wound, we are able to reach out to specialties and have them come in.
Have you
We
seen
can
cases like that as a hospice nurse?
Mhm. Yep.
Right. I mean,
I
it's not
mean,
that you're ignoring it, it's just you gotta follow protocol like everybody else.
exactly. And usually we have patients, a lot of times patients are at home, but we have patients that are in nursing homes and they have
Right. Right. They sure do.
their wound
Be
care nurses that are certified, and a lot of times they are certified, and so we will follow their guidelines because they are certified,
right, that's their expertise.
and so we will often follow we'll meet with them, we'll follow their expertise, and the hospice regulations say that the hospice nurse or the hospice is to manage the care. So even if they're in a nursing home or someplace else, the hospice is to manage the care.
Right.
But if there is somebody that is certified, we will follow their
Right.
regulate
You're
or
the team
we're a
sorry.
team. We're a team together.
What I was gonna say is you're the team lead,
Right.
but if you need to, you'll defer to expertise.
Absolutely, and
And I
we
get
will
that.
bring in other people, and we are able to bring in if there isn't somebody like if they're not in a nursing home, we can bring in PT, speech, OT if we need to. We can't bring them in to rehabilitate somebody, but we can bring them in for, like, a 3-time, val and treat, like, to help with safety training or
Right.
something like
Good.
that.
Yeah, I got you. Alright,
Yeah.
so my last question here. In your experience, what are some proactive measures nurses from various disciplines can take to mitigate the risk of adverse outcomes or complications in hospice patients? And how can they be integrated in our routine practice? I know that's a big one.
I'm sorry, my brain just went brain dead. I had a note and I had to look. I'm sorry.
It's all right. There's nothing wrong with notes. I got notes too. Look at me.
I had to look at that one
There's
because
nothing wrong with that. So basically, what I'm saying is, what the fuck can we do as other disciplines to help mitigate adverse outcomes, complications? So if we do get hospice patients, what can we do to try to mitigate adverse outcomes, or how can we keep from fucking up your shit with your patients?
again, I think that communication is key and it's really number 1. And I think that it's important to realize, like we were talking about earlier, that we all have different knowledge sets
Right,
and that you come from an ER place, we come from an end of life place,
right,
and, you know, a wound care nurse has that knowledge,
right,
and we can all work together, and respect is really key.
right,
What I'm doing does not diminish what you're doing or what the wound care nurse does.
right. But we're very territorial in nursing.
We are very territorial, and we can
We
be
are.
downright nasty
Yeah, we sure
sometimes.
can, can't we? That's right. Well, mostly women, not men, of course.
No, never.
Uh,
Never, never.
never men. It's only women.
You know,
That was a
it
joke, everybody. That was a joke. Calm the fuck down and shit.
sadly, yeah.
I know.
Women tend to be a little more so, I think, sometimes.
I get it. I mean, I don't know. I don't know where it stems from or why we behave this way, but
I was just gonna say, I don't know why we tend to
like to
be
beat
this
each other.
way.
Yeah, I don't either. Makes no sense, does it?
It doesn't. We are all working we should all be working towards
The same
the
goal,
same goal to
right?
help the patient, right? And I don't I just don't
I don't
understand.
either. Yeah, I don't either. So we're gonna wrap this up, but what is it that you would like to leave with us as a hospice nurse so we can leave you in a good light?
Well,
Not that you need a good light, but you know what I mean.
I just think that there's so much more to hospice. When I first started, our medical director, who was actually one of the first people that started hospice, helped get hospice going in Colorado, told me that he would give us 18 months to learn it.
Holy cow.
And by then we better know it.
It's a lot of pressure.
You're right. It's a lot. You're unlearning everything you learned in nursing school because in
Right,
nursing school, you're taught to fix, to cure, and you're having to learn to stop thinking that way and to think about comfort and to think
right.
about you're thinking in a holistic way. And it's just very different. It's a very different mindset from everything else I've ever done.
Well, because you're trying to help somebody move to the other side of the spectrum of the universe, wherever you believe in, you know what I mean? Heaven, hell,
Right.
the energy field, whatever it is. But I get that. Yeah.
Yeah, and
And
so
as a
you're
nurse, you want to treat people and fix them, but here, that's not your job. Your job is to just help them go
well,
through
and
this
you
process. And,
you have to try and keep your beliefs out of it, so you're
right,
trying really hard to not say something wrong
right,
because you're walking in and they may believe in Buddha or Hindi or whatever,
right,
so they may not believe in Jesus or they
right,
may be an atheist or so you gotta try not to step on so
right,
you have to be really careful because you're dealing with end of life,
right.
so everything is right there also, so you've gotta be really careful
I get
in
that. I
so
totally
many
get that.
ways.
I get that.
Um,
That's good. Yeah,
yeah, so there's just so much more to it than just but also you still have to, like, be able to put in a Foley and put in a catheter
right.
and
She'll do all that stuff too.
yeah.
Right. It's almost like being a psych nurse.
Yeah, and also, deal with the family dynamics and also deal
Mhm.
with the people with guns and
I can't be a hospice nurse.
so many
I
aspects that you just
yeah,
don't think about.
right, that's right. That's good. Well,
Yeah.
I really appreciate your time. I appreciate you spending your time with us. I know you
Well,
didn't have
thank
to, but
you.
it was great that you did that.
Well, thank
So
you for inviting me.
you're welcome. I hope you guys listen to us. Remember, this is Kevin, and this was Amy on a Transformation Nurse Academy podcast. All right, you bitches. Hope that you listen, download this shit, and don't be afraid to shout out to Amy and give her some feedback on being a hospice nurse.
Thank you.
Peace, bitches.
Don't miss out. Engage with us weekly, share your thoughts, and let's transform the nursing landscape together.